The terms insulin resistance, prediabetes, and diabetes can be confusing. We will focus on how to identify each one. We'll explain how to recognize the early warning signs of insulin resistance, prediabetes, and diabetes. Plus, we'll provide simple, actionable tips to manage or even reverse these conditions before they become more serious. The earliest stage among them is insulin resistance. This condition is usually silent and progresses over years, but it is reversible with lifestyle changes. Prediabetes is the next step, affecting almost 40% of the American population. It is often still silent and can progress into diabetes, a much more serious condition. If left untreated, diabetes gradually damages blood vessels and nerves and can be life-threatening. Insulin resistance means that body cells, especially muscle, fat, and liver cells, become less responsive to the hormone insulin, which is crucial for glucose to enter cells. To compensate, the pancreas starts producing more insulin to increase glucose uptake into cells. This process is known as insulin resistance. If left untreated, the condition progresses, reaching a point where the pancreas becomes exhausted and unable to produce sufficient insulin, leading to a significant reduction in insulin levels. When insulin levels drop, glucose levels rise. When glucose reaches a certain threshold, it becomes a hallmark of diabetes. Prediabetes occurs between these stages, where glucose levels are elevated but not high enough to cause significant harm to the body. In other words, during the insulin resistance phase, insulin levels are high, and glucose levels are usually normal. During prediabetes, insulin levels are often still elevated, but the body's compensatory mechanisms begin to fail. Glucose levels start to rise, typically between 100 and 125 milligrams per deciliter. At this stage, glycated hemoglobin, which reflects average blood glucose levels over the past 2 to 3 months, is also elevated, ranging from 5.7 to 6.4%. This is not diabetes but a pre-diabetic condition that will progress to diabetes if left untreated. In diabetes, insulin levels may be elevated initially, but as pancreatic beta cells become exhausted, insulin production decreases. Glucose levels are elevated, typically above 126 milligrams per deciliter, which is diagnostic for diabetes. Another diagnostic criterion is when a person is given 75 grams of glucose, and after 2 hours, their glucose level is more than 200 milligrams per deciliter. Additionally, glycated hemoglobin levels, which reflect average blood glucose over the past 2 to 3 months, are elevated above 6.5%. Excess glucose attaches to hemoglobin, forming glycated hemoglobin, so when glucose is chronically high, this proportion also increases. A normal fasting blood glucose level is generally considered to be between 70 and 99 milligrams per deciliter. After ingesting 75 grams of glucose, their glucose level after 2 hours should be less than 140 milligrams per deciliter, and glycated hemoglobin should be less than 5.7%. If we consider how to detect the earliest signs of insulin resistance before prediabetes and diabetes develop, we can focus on several very early indicators. The first sign is Acanthosis nigricans. This is one of the most common physical signs of insulin resistance. It presents as dark, velvety patches of skin, often found in body folds and creases, such as the neck, armpits, elbows, knees, and knuckles. The exact cause of this skin discoloration is not fully known, but it is highly likely that insulin stimulates the growth of skin cells and melanin, leading to this discoloration. Another sign is skin tags. These are small, soft, benign skin growths, typically found in skin folds, such as the neck, armpits, and groin. While skin tags can occur without insulin resistance, the probability is higher in cases of insulin resistance. The third important sign is central obesity. A larger belly increases the probability of insulin resistance. An apple-shaped body is particularly closely related to insulin resistance because abdominal fat is metabolically active, leading to increased production of free fatty acids, which eventually causes tissue damage and disrupts insulin responsiveness. Another sign is elevated triglyceride levels and low levels of good cholesterol. Normally, insulin affects not only glucose but also inhibits the release of fatty acids from fat cells. When insulin resistance occurs, this inhibition is removed, causing fatty acids to be released into the blood, where the liver converts them into triglycerides. This is why triglyceride levels increase. In women, insulin resistance can cause polycystic ovary syndrome, which is characterized by irregular menstruation, acne, and excessive hair growth, known as hirsutism. This occurs because insulin stimulates the ovaries to produce androgens like testosterone, which is a male sex hormone. Insulin also decreases the production of proteins that bind and block these androgens, leading to more free androgens in the bloodstream. This affects hair follicles, causing hair growth in a male pattern, and also leads to more oily skin, which causes acne. Another and one of the most important signs is weight gain. Insulin directly stimulates fat storage, so high levels of insulin cause more fat to be stored in the body and less fat to be broken down. Insulin resistance is also commonly associated with leptin resistance, which involves the satiety hormone. Ineffective leptin means a person feels hungrier more easily and experiences less satiety after eating. The mechanism behind this is that the more fat a person has, the more leptin is released because leptin is a hormone produced by fat. Over time, the body becomes less responsive to leptin, leading to leptin resistance. This creates a vicious cycle where the more obese a person becomes, the less satiety they experience with food. Now, let's discuss insulin resistance treatment before diabetes develops. A balanced diet is the first and one of the most important steps. This means reducing sugar intake as much as possible. Increase your intake of non-starchy vegetables like almost anything green, such as broccoli, spinach, kale, Brussels sprouts, bell peppers, zucchini, and cucumbers. These are low in calories and carbohydrates and rich in vitamins, minerals, and fiber. Reduce your intake of potatoes and corn because they contain starch, which also increases glucose levels. Increase your intake of fiber, especially soluble fiber. For example, oats contain beta-glucan, a type of soluble fiber that helps reduce blood sugar spikes. Legumes, such as beans, lentils, and peas, are also good choices as they are high in soluble fiber. For fruits, apples, oranges, and pears, with the skin on, are high in soluble fiber. For insoluble fiber, whole grains like brown rice, whole wheat, and bran are healthy options. Nuts and seeds, especially almonds, sunflower seeds, flaxseed, walnuts, and almost any other nuts, are beneficial. Portion control is important. For example, if you eat brown rice or quinoa, limit it to half a cup. If you eat meat, aim for around 3 to 4 ounces, which is roughly the size of a deck of cards. If you eat vegetables, do not eat a whole plate, half is enough. For fruits, a medium-sized apple or a handful of berries is sufficient, rather than multiple servings. The same is true for nuts and seeds, a small handful, around 1 ounce or 30 grams, is enough. Physical activity is crucial. Aim for 1 hour of exercise daily. Start with small amounts and gradually increase the intensity. Brisk walking is one of the best methods of exercise. Weight loss is important. Losing 5 to 10% of body weight significantly reduces the risk of diabetes. From a medication perspective, metformin is the first-line treatment to improve insulin sensitivity, particularly in prediabetes patients. It reduces hepatic glucose production and increases glucose uptake by muscles. Pioglitazone is also used to improve insulin sensitivity in adipose tissue, muscle, and the liver. These medications are sometimes used when lifestyle changes and metformin are not sufficient. Additionally, GLP-1 receptor agonists can be used in obese individuals to lose weight and improve insulin sensitivity.